What's going on, family? Your midday base Stichiz here, checking in with our friends at Broward Health. It's information that we need to know, raising awareness and talking about men's health. You know, June was Men's Health Awareness Month, but health is important every day, right? So I'm excited to have Dr. Stefano. How are you, Doc? Thank you for joining us.
Hi, everyone, and thanks for having me in the program. I'm really excited to be here and talk about a very important topic such as men's health.
Now, Doc, if you could please introduce yourself to the beautiful people for those who are hearing from you for the first time.
Absolutely. My name is Dr. Stefano. I'm a colorectal and general surgeon. I work for Broward Health in all locations associated with Broward Health.
So let's get straight into it, Doc. What are some key health risks men should be aware of, and how can they take preventative steps?
Yeah, so there are several things that come in mind when you ask that question, but mainly heart disease, for example, which is the leading cause of death in men. And this is something that is very preventable, meaning that we can do our part to decrease the chances of having issues related to this, such as having a healthy diet, staying physically active, going to the doctor and having blood pressure and a blood work checkup routinely. It's another thing, and quit smoking is another big thing related to heart disease. Other things, especially these two, this one specifically to men, it's the prostate. Since females don't have a prostate, we're the only ones to have it. Unfortunately, this organ can cause issues, including cancer. The best thing to do for this is to really, when we're approaching that age of the 40s or 50s, go talk to the primary care doctor to see what will be the screening test to start looking for this.
Nice.
Another thing would be cancer of the testicles. Same thing. If you talk to your primary care doctor, but also if you notice any abnormality related to the testicles, please don't wait and go have a doctor take a look as soon as possible. Another important thing, and this is not just to men, it's diabetes.
Right.
So, diabetes is related to having a family history of diabetes or obesity. So it's really important to stay active, eat healthy, decrease the amount of sugar and carbohydrates that we eat daily, and monitor our blood sugar levels. And one big one, especially for me, because it's colorectal cancer. And this is, lately being really concerning in younger adults. Right now, actually, it's the leading cause of cancer-related deaths among men under 50. So this is really, really important.
And that's under 50, you said?
Yeah, it's the leading cause of death under 50. However, after 50 is still one of the leading causes of death related to cancer. But, it's been showing up on the news a lot because we've seen it more on younger people.
Wow.
Yeah, and, multiple reasons, but genetic is a huge one, but also diet is really important, and we think this is very closely associated with this.
So when you say young, so that's between 18, 20, 30, and up, eh?
Under 50, yeah. Yeah, no, I'm just saying, the most important thing to do is, if you have any family members with this diagnosis, please talk to your doctor now. Don't wait. Because if anyone in your family had this cancer at a younger age, you qualify for a screening check at an early age. Currently, we start the screening process at age 45. So anybody, men or women, age 45, they need to talk to their primary care doctor about what screening tests are out there for them to have a regular checkup to be able to detect any abnormality at an early stage, where we can do the best job treating this.
That's good. Thank you for sharing that. So you did mention regular checkups and screenings, from blood pressure checkups, cholesterol tests, prostate, all the things, right?
Yeah.
Okay. Anything else you want to add related to checkups that people should know?
Go see your primary care about it. Discuss this and keep your health checked regularly. That's the best thing. And don't wait until you have the problem.
Right.
Because these check screening are, the main reason we do them is to detect anything at an early stage.
That's awesome. Thank you for sharing that. And Doc, one more question. What simple lifestyle changes or actions really can men take every day to improve their overall well-being? What simple steps can they take?
Yeah, and they're simple, but they make a huge impact on our health. So some of the things is exercise regularly, at least 30 minutes, 4 or 5 times a week, or it doesn't need to be a strenuous physical activity, but for some people, walking, for some other people that can do more, absolutely they can do more than that, but don't be discouraged if, like, for example, you can't be running for 15-30 minutes, but you can do something that is good for you, and this is really good for your health. Eat a healthy diet. So healthy diet meaning decreasing the amount of carbohydrates and sugars and fat, eating more protein and fiber, like vegetables, salads, things like that. And, avoiding things like smoking and alcohol.
Mm-hmm.
Alcohol, one glass of wine, for example, or only a day might be good for your heart, but in excess is not good. It might be detrimental for your health. And also another big thing would be sleeping.
Yeah.
Very important. We basically regenerate while sleeping, and our brains. Mental health is really important, and sleeping will make your mental health better.
And the typical hours of good sleep, what is recommended?
About 8 hours a day.
Okay, I've been doing it wrong. 2 hours is not enough. All right. Thank you, Doc. Thank you. I'm teasing. No, 8 hours, 9 hours, that's a sufficient amount, and that really makes sense with just rejuvenating the mind and the body. So thank you so much, Doc, for sharing all these amazing tips. If people want more information, or if they want to, I guess, connect with you and schedule an appointment, where can they go? Or who can they call?
Yeah, my office is at the Fort Lauderdale at the Broward Health Medical Center, and my office phone number is 954-463-3131. So if we're always available, and if you would like to schedule an appointment, feel free to call that phone number, and we'll take care of that.
Awesome. Health is important, and like they say, health is wealth. So Dr. Stefano, thank you so much for your time from Broward Health. So prioritize the health, family. Thank you so much, Doc.
Thank you.